Okay. So, hi, evening friends, evening everybody, bache. It's actually afternoon. Okay, so afternoon everybody, bache. I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MAMC, MD Pathology, Resident Hemat-oncology, AIIMS Delhi. So, सबसे पहले the first exam of the year is done and dusted. That is the INI-CET exam. खत्म हो गया है, no doubt about it. Just let me see if everything is working fine or not. Yes, so the INI-CET exam is done and dusted. The whole purpose of this session is to analyze what was asked in the paper, more importantly the topics which were not asked, the commonly asked topics which were not asked, and they will have more importance for the NEET PG. And the most important point, that is the plan ahead for the NEET PG exam. I'm not going to talk of scheduling here, but we will discuss the topics and the main things which you should focus on for the NEET PG, because in the end that is our main battle. That is what the purpose of this whole session is. First, very important point, I am actually glad, अच्छा देखो, I am actually glad that the paper was not tough. Nobody is feeling depressed today, no one is way too depressed, in the sense कि ठीक है, I am getting mixed reactions about the paper. Some people are saying that yes, it was lengthy, the questions were tricky, they were not as simple as they seemed. Some of the questions were extremely straightforward. So you guys were saved. There's no doubt about this, that you were saved. It was not that depressive a paper कि 20-30 क्वेश्चन ना आते हो या something like that. But that does not mean you have arrived. The race has just begun, because our final target with much more number of seats and जो निकाल के for majority of us खत्म करेंगे is the NEET PG exam. So let us have a look at the INI-CET July 2021 paper. Now how many questions were there from the first year and the second year subjects? ABC which will go percentage wise, or we'll go point wise for all the students who had given the paper. I mean, you know me, you know our sessions be extremely informal. Keep on writing it in the chat box. Yes, Sabaya, she totally agreed. Forensic, the questions were suddenly increased. This was unexpected. Another unexpected point in the paper was that from forensic, no IPCs, no Indian penal codes, or no IPCs were asked. Usually that is one of the favorite questions in the forensic. The point that was not asked. The paper had mixed questions. The easy questions which gave a false sense of security to the students, and yes, I'm saying it as a false sense of security, but yeah, because they were non-discriminatory in nature. All the rank holders, everybody for that matter, everybody will be marking the extremely easy questions right. We can divide the question into two types now: discriminatory and non-discriminatory. Non-discriminatory are either very easy or very tough. So you had the easy questions giving you a false sense of security. We have to come out of this false sense. That is the first point. Second point, many students are telling me that the questions which were there, they were tough and slightly on the lengthier side. Those are the questions on which more time had to be spent. Of course, we will be coming with respect to all the questions and everything. I'll have all the questions by tomorrow afternoon or evening, and we will be discussing that. But do not fall into this trap. This is a mouse trap. Thinking that the paper was easy is a mouse trap. I mean, despite whatever your thought process is at present, you will realize what I'm saying within a day. Next, rank deciding for this year would be pharma. Actually, bache, the integrated questions of radio medicine path, as well as pharma, these will be the thing, R Gupta, which these are the three things I'll be saying. That next, another important point, and which was sort of expected, was no assertion reason and no true false. In one of the sessions recently, about 10 days ago, which I did, I had laid stress that do not even think of doing the PGI questions. That will be pure time waste. So that was expected. No theme based questions were there, so this was the slightly unexpected part. We were expecting few theme based questions. I mean, I'm very frank. So I was expecting few theme based questions to be there. No theme based questions was unexpected, but assertion, reason and true false were not to be expected in the paper as such. Next, cutoff Akhila bache, cutoff is going to be high because majority of the students have attempted. Asha, before I say this, you guys tell me, how many questions did you attempt? How many questions did you attempt? Answer. How many questions were attempted? See, at any point, suppose if 150 students are seeing this session live, so that means it will give us a very fair idea of a cross section that this is the number of questions attempted. The data that I have with me, I have about 300 to 350 responses on this. Majority have attempted 180 plus questions. 180, 187. Balakrishnan nahi bache. 180 plus. Dekho, again, keep this in your head, strike this, write it on stone, do it whatever. Total questions to be attempted, is total minus 10%. This is the minimum number of questions to be attempted. देखो अब INI में whether you attempted less than 170 or something, that is sort of disastrous in this paper. In this, ideal number was 180 to 190. The only question that you will leave in this are the 7-8 questions जिसमें चारों options का कोई idea नहीं था. For the NEET PG, I mean, promise me this, the first take home message of this session is, you under no circumstance you will attempt less than 175 questions. 175 to 185 questions will be the ideal range for NEET PG. This is the first take home message of this session. Next point, coming to this. So these were not the things which were asked. Those of you who have not covered the PGI questions or have not wasted time on PGI questions listening to me whatsoever, good for you, firstly. Secondly, the questions that were asked. Firstly, we saw what was not asked. Now coming to what was asked, bache, clinical images and concepts was asked. You need to know path and pharma, the second year subjects. They were asked in majority of the questions. Close to 45 to 50 questions had path medicine or radiopath correlation. So integrated questions, the USMLE pattern integrated questions are going to be the rank deciding in these two. Shubham bache, perfect 192, perfect. हाँ, rhabdomyosarcoma, why maintain? So basically agreed those, totally agreed. Path biopsy questions. So images are again going to be the key factor. Numerous images are asked, and when I say images are asked, they are not very hi-fi. They are not going to give you variant of a rare disease or something. Schwannoma, simple images. Pap smears, schwannoma, Peutz-Jeghers syndrome, PJ polyp, something that, you know, we as faculties are after your life. I mean, so many times one of the students recently, she is a friend also, she was saying, sir, you usually give the same, while revising with us, you give us the same set of 30 images and 2-3 images you add in every session. But yeah, because that is what is needed. You are not here to do MD in 19 subjects. Your notes are going to be sufficient. That is the biggest second take home message. Have faith on your notes. Do not keep on jumping from one point or the other. Let me imbibe this, let me imbibe that also. As a result, you screw up on the commonly asked topics. Do not do that. Absolutely do not do that. Topics are repeated. The STIs, COVID, we just 2 days before we made a list of the commonly asked topics. Those topics, I mean, I had given a list of, I think, about 300 to 350 topics, out of which 150 topics were asked. That was the session, that is 2 days before INI, topics to be done. So notes are going to be sufficient. It was a very standard paper. Next, bache, 29th, the result will be 29th, 30th. More options were far apart, many single liners. Totally agreed, totally agreed. Now this was something, now this is a very important slide with respect to NEET PG exam. I am saying so because these were the 5 topics, frankly, which were important with respect to INI also. but they were not asked this time in INI. They were not asked in INI, so they become more important with respect to NEET PG. I'm saying so because this will not happen that you had 4 questions on pap smear this time in INI, and similarly you will have 3-4 questions in NEET also. The chances of the same thing, exact same images getting repeated are on the lower side. So do these topics extremely well. See, that is how, if I was sitting in your chair, it is not about knowledge. The last 2 months is about how well mentally you analyzed the paper and you're preparing for the same. So Rohan, nahi bache, I did not even see your question. I'll take care of all the questions. I mean, not to worry. Absolutely not to worry. I am not going to ignore any question. Give me 2 minutes now. Let me first take care of this content and then I'll take all the questions. Next point. So ECG, acid based disorders, pediatric milestones, they are always and always asked in NEET PG. IPCs, just because they were not asked this time does not mean will not be NEET PG. And embryology, especially cardiac embryology, you did not have any question from these 5 topics in INI. Now before we go further, but I'll start taking care of all the queries. Rohan, how many questions need to be correct to be in top 100? देखो दोस्त, it is a very dicey question to be asked, and I will say so that if I was in your position, I will not think in those terms. This is because as a student, my target will be to get all or maximum possible questions correct, all or maximum possible questions as correct. For the NEET PG exam, I mean, I will have that session either tomorrow or day after, of the approximate rank with number of questions. We will do that session, no doubt about it, or if possible I'll schedule it today only. But the point to be noted is, this should be the thought process, that we have to do the maximum number of possible questions, right? Not think about the rank while solving the questions. Next, Praveen, nahi dost, lymphoma, the marker is CD45 or LCA, leukocyte common antigen. Next, acha, I'll actually be glad if you guys can tell me, because everybody is there who gave the paper, majority of you are there, but pap smear, which images are asked? I'll be very glad if you're able to tell me that. Next, which topics are expected in NEET PG? Mohit, bache, these dekho, we have the list of all the commonly asked topics in the NEET PG. I'll do that session again. The list has already been uploaded on my Telegram group. But in addition to those topics, these 5 topics which were ignored in INI, I will certainly be doing them extremely well for the NEET PG. That is what I'm saying. Matching, there were many questions. Okay, I saw they're asking instruments that are required for any particular surgery, so they are going to the practical aspects of the same. If instruments for practical surgery are being asked, think of it this way, that if instruments for practical surgery are being asked, so they can even give you an image of the surgery to be recognized. That was what they did in the last year INI as well as the NEET PG paper. So surgery and obs gynae, while studying, think of it from that viewpoint also. Next, microbiology had good number. Okay, nahi, I do not have the micro set till now. Acid base ka question kaun sa tha dost? Most of the questions seem to be from direct repeats of previously asked questions and grant tests. This is true. The paper was standard. Acha, but I will tell you one more thing. Matlab, this is my very personal opinion. When the paper is slightly of mixed nature, we as underdogs, personally me, I have never topped anything in MBBS or something, but I was good in solving MCQs. So we as underdogs have much better chances when the number of discriminatory questions are on the higher side. The rankings, the cutoff, and everything rises in case the paper is on easier side. I am saying so. I'll tell you the implication of this. All of us would have done at least 3 to 4 silly mistakes. 3-4 silly mistakes are very obvious, in the sense that we got dicey marked B instead of C or whatsoever. Those are silly mistakes. In a paper with more number of discriminatory questions, these silly mistakes are covered. Whereas if the paper is on the easier side, each silly mistake is suicidal. So when we are praying to God and hoping for the NEET PG exam, we want more number of discriminatory questions. We want more number of discriminatory questions. Firstly, next point, in PAP, even the staining technique was asked. PAP staining technique, when last year NEET PG exam was done, you had a question on the types of fixatives. You had a question on types of fixatives. While doing its discussion, I had very clearly told about the PAP staining technique also, because I had said that this is the next level of question. After the types of fixatives, that is the histopath lab, the next is the cytology lab, and in cytology lab the main stain is pap staining, so we had done the pap staining technique at that point. But this is the relevance of an extensive discussion by subject faculty, in the sense that we always do 2-3 extra points with respect to that question, and this is important. Air spatula and brush was given. What should we do now? More notes or more MCQs? Again, a very valid question. It will depend. Firstly, give grant test. Acha, tell me this. How many of you are thinking of taking rest today? Let me put it this way. Taking rest. Yes, yeah, no. How many of you are thinking of taking rest? If I was in your position, this is the first time, like usually after the exam, I always say ki bache, you have worked hard, you were under stress, this that, take the day off and start from tomorrow. But today was a paper, and I guess in my 7 years of teaching history, this is the first time I'm saying this. Start from today. Start from today. If you got up early, you are feeling too tired, sleep for 2 to 3 hours, but start studying from today. This reduces the guilt factor drastically. Now you will say ki sir, why should we have guilt? Because now till this point the result is not out yet. Again, I'm saying something very bluntly. I mean, I don't think majority of the faculties or any of the faculties will say this for this matter, but which the number of seats are drastically low this time in the mid-year INI exam. Irrespective of how well you have done the paper, you getting your dream seat, theoretically speaking, in your dream college, your chances will be much higher in NEET. क्योंकि अब की बार, especially with respect to general category, the seats are very low in INI. If you have seen the seat matrix, they are low. So start from today. You know the type of questions that are asked. You know that the topics are repeated, and you know that random weird questions are not being asked. So how to start or what to start? That is whether to do more number of MCQs or theory portion. Firstly, give grant test. देखो, आज नोट्स या MCQ करने की तो हिम्मत नहीं होगी. अगर हिम्मत है, इफ़ यू हैव द एबिलिटी या हिम्मत है कि हम थोड़ा सा और मरवा सकते हैं, सो शायद बच्चे 6 सिली मिस्टेक्स, आई नो 3 to 4 सिली मिस्टेक्स आर वेरी वेरी, मतलब everybody does that. Everybody does that. You have to travel. Mohini bache, those of you who have to travel, fair enough. But those of you who are at home and have the ability कि नहीं कर सकते हैं, एक तो सबसे पहले your seat is within your grasp. मतलब there is no other way of saying this. Your seat is very close. It is within grasp. We are not going to screw it at this point, especially with the type of papers that are coming. This is a paper which is made for us. When I say us, it is made for students. I mean majority of us, including me, we were always in the middle group in the MBBS. We were not toppers, we were not in the lowest category, we were in the middle group. This is the type of paper which gives you a very good fighting chance, because if the paper was extremely tough, the toppers take the cream. If it was too easy, then everybody is in the pool. This was a very very balanced paper. It was actually balanced. Do not think of it on the easy side. So when I had put this question on Telegram, I actually got the input as I think around 400 or 450 students had only answered till the point when I saw it. So 30% were extremely satisfied, whereas 20 to 25% were dicey कि सर नहीं पता चल रहा है what sort of a paper it was. and this tells you that this is the kind of balanced paper. If it was extremely tough, it would, the majority would have been in the second category. This is the type of paper you are expecting in NEET also. Next, पायल बच्चे, I'll finish my first reading in August second week. Revision नहीं देखो, August second week तक you do not have to extend your reading, in the sense that, okay, we were talking about strategy. What I would have done if I was in your position, those of you who have started studying today, instead of picking up a subject, make a schedule, analyze where you went wrong by giving a GT every week. You have to give a GT now. Matlab, this I am talking of minimum one GT per week. And when I'm talking of giving one grand test per week, I don't mean that you are spending 2 to 3 days on a grand test, but half a day. Your grand test will be for 3 to 3.5 hours. Suppose it is 3.5 hours grand test, you took half an hour break after that. So the questions that you were wrong in, reading the explanation of the same versus the right questions, just flipping through them will take additional 3 hours. So one grand test should be over maximum in 7 hours. This we are talking of maximum. I want all of you to put in 12 to 14 hours per day of effective study time. I am not concerned how many times you have revised it till now. I am not concerned the paper was extended, you got extra time. Sir, पता नहीं चल रहा है क्या पढ़ना है. कुछ नहीं बचे, बिल्कुल कुछ नहीं. For the same, make a schedule and you have to revise all 19 subjects. More number of forensic questions this time actually told us that you cannot think of leaving a subject. No doubt. Next, COVID plus mucor, Mohini, true bache, true. COVID and mucormycosis was it was expected, but not actually 5 questions. Frankly, if somebody had asked me, I would have said maybe 2 questions on COVID or 2 or 3, but not 5. Another, if you had asked me that if pap smears, I would have said one was minimum, 1 to 2. Not even 4, but that is the way the paper was. Nahi bache, Nikhil, don't you have that many GTs yaar? With respect to Unacademy, nahi, aisa nahi hai ki there are, you do not have that many GTs. I mean, with respect to Unacademy, I'm personally on the scheduling team. So from, you have this GT on the last Saturday, that is 22nd, and our Saturday is 24th. You have GT on 24th July GT. It is a complimentary GT for everybody. You can simply use the code Patho Unacademy for opening up. After that, from the month of August, you have one GT per week, one grand test per week. So on every Saturday 10 a.m, on every Saturday 10 a.m, and all these grand tests are free and complimentary for everybody. So the fact that you do not have that many GTs is not a valid statement. We are there to take care of you, and the quality of questions are being supervised by all the respective subject faculties. So the questions are going to be good. Give these grand tests. Next, grand test score is stuck. Number of rights are not increasing. This is again a very common query. Grand test score or the number of right questions are not increasing. Firstly, another common query that students are saying is ki I am not able to attempt more number of questions, like I get uncertain, and the minute I attend more number of questions, when I do more number of questions, my score drops. But to this I will say, you have at least 7 grand tests, at least. On Unacademy platform itself, I will personally take care of your 5 to 6 grand tests. You have minimum of 7 grand tests before your NEET PG exam. Attend more number of questions. In initial 1 to grand tests, your score might fall, but gradually it will increase, and you will be training yourself. You are training yourself for the final war, not for every battle. I mean, no doubt. Crazy for pizza. I mean, I love your name, but yes, I am writing this in capitals. All these grand tests which are on Saturday, please do confirm the time once. I think it is on 10 a.m. only, but please do confirm the time, are free for everybody. They are absolutely free or complimentary for everybody. Next, nahi bache, do not think of doing one-liners at this point. I mean, actually, dear, you have asked a very valid question. For NEET PG, should we do more number of one-liners? Should we shift our strategy from the integrated questions to one-liners? No. And I am saying so because when you are doing integrated questions, one liners are automatically taken care of. It is like when you take care of the dollars, pennies take care of themselves. One liners are pennies. Pennies take care. They take care of themselves. Take care of the dollars. Take care of the integrated questions. These will be more rank deciding as compared to one liners. You'll be able to mark them. Next, Prithviraj, हाँ बच्चे, all the grant tests at present are being scrutinized personally by the respective subject faculties. They who no grant test, I can personally say with respect to pathology, no pathology grant test of Unacademy will be passed or questions will be put in without the questions going through me first. That is the same thing is being done for all 18 subjects. So do that. EF, बच्चे, total number of questions minus 10%. Those are the questions to be attempted. Next, revision is the key. Next, consaya bache, it was an unfavorable paper. Nahi. The minute you put a negative point or a negative thought in your head, that further, that further reduces the effectiveness. No negative thoughts. कोई फर्क नहीं पड़ता आईएनआई का पेपर कैसा गया या कैसा नहीं गया, बिल्कुल फर्क नहीं पड़ता. वी विल बी फाइटिंग फॉर अवर सीट, दैट इज नीट पीजी. I'll give you one more example. I mean, I'll say this. One of the students actually in my last year when I said this, so he had asked कि sir why are you saying this कि फर्क नहीं पड़ता है. बच्चे, this is because suppose a student has a very good rank in INI, but because the number of seats are less, he is getting anesthesia. So he calls me and asks कि sir, anesthesia, I don't want to pick it up. My target is medicine. Should I compromise and take anesthesia, or should I go for NEET PG? What will be my answer? Bache, go for NEET PG. Of course, you will easily be able to pick up medicine. Your dream college, dream branch in NEET PG. अच्छे से लगा पढ़ के ख़त्म करो. So we will not be compromising on our branch for the sake of AIIMS tag. That is what I am saying, and that is the reason for NEET PG being your main stress at this point. I guess that is it, Mohit Bashir. Really, really thanks for the kind words. Absolutely thanks. Yes, 18 gauge cannula green was asked. Next, I just remembered. Nahi bache, both the C, option C always is the right answer. I mean, I'm really glad that you marked C to two answers and they were right. I mean, that is plus 10 marks, because plus 4 minus 1, had it gone wrong it is plus 10. I mean, it's really, really good. Done hai. Absolutely done hai. So I guess at this point, what to do about weak subjects? Dark angel, which I'll take your query as the last one, and I guess all the queries have been taken care of in the previous 10 minutes of the session. The query is question bank or theory notes. But when you do your grant test, see the question that you went wrong in. Was it because you were able to recall the theory but marked the MCQ wrong, or it was a new concept to you, as a result you did not even know the theory part? If more number of questions in a particular subject are falling in category 1, for that subject do more MCQs. Whereas in the subject in which the new concept, your theory was not up to the mark, in for that subject do theory. So there is no one principle fits all funda in this. You have to make it person specific as well as subject specific. You are the bestest judge of your schedule, your preparation, your strategy, and your rank. As faculties, we are always there to guide you, but the final mentoring or the final personal touch, it has to be individualized, firstly. Secondly, how to do subjects. One of the students had asked me earlier that I'll be finishing it on 2nd August, the second week of August, something like that. नहीं बच्चे, 22nd July, by July end, मतलब second week of August तक तो किसी हालत में नहीं जाना है. You do not have to go till that point, because by July end all 19 subjects theory should be over. What I'm saying is, whichever subjects you are left with, do the crash course of the same and get it over with, firstly. Another query that was asked was, should I rewatch the crash course videos, or should I recall my notes? But it totally depends on what your thought process is at this point. What makes you recall more? If you have well handwritten notes of your own, then you will have photographic memory of those notes ki this was written on left upper side, this was written on the lower side, and so on. So at our time, all of us, we used to make our own notes. So if you have that, you can revise your notes along with the grand test, provided your 19 subjects are over. Whereas if you do not have your notes, or your recall is better if the faculty is speaking the content, if the faculty is speaking and writing it fatafat say, in that case, go for the crash course. Crash course is available on both Unacademy as well as PrepLadder. Unacademy crash course, the faculty is live. PrepLadder, it is a recorded session. It absolutely does not matter. The content is totally the same. The modality is different. So depending upon what you are more comfortable with, choose that. But bottom line is, you have to revise, and revision is the key to success. Revision is the key to success. Lastly, bache, nahi crazy for peace. EF bache, how many revisions for NEET PG from today? One revision. This will be your last one revision. This is your last one revision till NEET PG of all 19 subjects. One revision does not mean कि हमने उसको फटाफट से भगा दिया. It is a good proper revision in which you recall what you have read. One last revision, give it your best shot, and everything will be okay. And बच्चे absolutely nahi, Chandrima, there is no concept of FOMO at this point. I mean, the paper, INI paper has clearly told us that there is no concept of fear of missing out. It was a standard paper. NEET PG, standard paper is expected. You know your concepts. Do not go for too much tougher things. Mind has a limited capacity to remember. इजी वाले क्वेश्चन गलत हो गए बच्चे तो बहुत गड़बड़ हो जाएगी. सो नो थॉट्स ऑफ फोमो एट दिस पॉइंट. कुछ नहीं होगा. INI-CET की रैंक का क्या इफेक्ट होगा बच्चे? कुछ इफेक्ट नहीं होगा. देयर इज नो इफेक्ट. आई डिड नॉट इवन अंडरस्टैंड योर क्वेश्चन. आई एम सेइंग सो बिकॉज इतना तो सोचना ही नहीं है. कीप योर माइंड uncluttered. I again always say this, the more uncluttered your mind is, the more focused you are, higher are the chances of having your dream branch, dream college. So keep your mind uncluttered. No effect, nothing, no FOMO, no depression. Only thing is, you are sitting and studying from today. Those of you who are not traveling, बच्चे चाहे 100 questions करें grand test के, promise me this, give me a thumbs up, or you can simply like the video, but promise me this, even if you are traveling here, whatever, minimum 100 questions to be done today, along with explanation of the subject that is your weakest, or the subject that you find the most boring. Because these last 2 months, there is no concept of a weak subject. There is nothing is boring. जिंदगी में आखिरी बार 19 सब्जेक्ट पढ़ने हैं, उसके बाद मतलब we guys will have a bonfire. These will be the books which we will be burning, and we will have a bonfire. मतलब we will never be studying these books again. We'll burn them off. We will not even give them to our juniors. They will have buy their own ones, or whatever it is. Last 2 months, give it your best shot. 100 questions is a promise from everybody. Done hai bache. Weakest topic 100 questions, or the most boring subject 100 questions, either of the two, but we will do it today. Done. Absolutely done. Arpita, I am actually glad that I was just going through the questions. How to not consider the previous failures, how to not take old failures as your baggage for future. But you think of it as, when we were in 11th 12th, all of us had a heartbreak. I mean, सबका हुआ है. I don't think there's anybody, I mean, हम लोग कुछ लोगों का तो every week होता था, but no such person is there who has not suffered a heartbreak. But we fell in love again. The life is beautiful. We moved on. This paper is nothing. It is not even a speed breaker. It is simply a bump on the road, yaar. As you will become senior, as you will go further in life, you will actually feel that this was nothing. So this failure, this baggage is nothing in the process of in is nothing is in the long process. So कुछ नहीं सोचना है. Keep your mind uncluttered and keep on studying. Absolutely done hai. In case you have concentration issues with respect to seeing recorded sessions, in case you have not made your self-made notes or whatsoever it is, if you want the faculty to sit with you and tell you the content fatafat se, because if I was in your place, this was the mode that I would have preferred. But again, every person is different, so totally person specific. But padhna sabko hai, nikalna sabko hai. So last mile to NEET PG, this batch had started 5 to 6 days ago, and you can use the code patho UA, that is patho Unacademy, for additional discounts. Good luck bache, and the race has just begun. This is the most important point. Actually the race has just begun. टेक केयर, टेक केयर. केस ऑफ बच्चे कोई फर्क ही नहीं पड़ता कि whether you did well in the exam or not. The main exam is yet to come. So does not matter. The absolutely does not matter. Yes, and Vyapashi, a bend in the road is not the end unless you fail to make the turn. Matlab, beautifully said. This paper is just a bend on the road. We have a long journey to cover. Huh, I'll put a daily clip. I will put a daily clip on the app. Done hai bache. Absolutely done hai. Thank you and take care everybody. Have a 2-3 hour sleep if you wish, and then start studying. Take care bache. Take care.